You may remember the time not very long ago when IV therapy almost always meant peripheral IV therapy. That's not the case anymore. These days, central IV therapy is becoming commonplace in many inpatient and even outpatient settings. In fact, central IV therapy promises to become even more common than it is now because of changing health insurance regulations, a growing number of critically ill patients, and continued technological advances. This videotape reviews the most important facts and procedures you need to know to administer central IV therapy. It describes the catheters you'll be using, steps needed to establish and maintain them, methods for administering fluids and medications through them, and complications you may encounter and what to do about them. In this video, certain procedures will be performed on mannequins. A patient's doctor may select central IV therapy when the patient needs lengthy infusion therapy lasting weeks or years, needs hyperosmolar medications or nutrition therapy, needs vesicant medications, needs immediate large-bore IV access, or has inadequate peripheral access. Central IV therapy can be used to deliver medications, fluids, blood products, chemotherapy, and total parenteral nutrition. It also can be used to monitor central venous pressure and cardiac efficiency, and to obtain blood samples for tests. Now let's discuss the various types of central venous access devices. They include peripherally inserted central catheters, commonly called PICC lines, non-tunneled catheters, tunneled catheters, and vascular access ports, or VAPs. When working with any type of central venous catheter, remember to always observe standard precautions. Check for latex allergies, use safety needles and needleless systems when possible, and wear personal protective equipment such as a gown and a mask. If your patient needs central IV therapy for 5 days to several months, or he needs repeated venous access, a PICC may be the best option for him. PICCs may be single or double lumen. The gauge or diameter of a PICC is based on the size of the vein being used. The catheter should be small enough to allow blood to flow normally around it. Usually, a PICC is inserted into the median basilic or median cephalic vein in the patient's arm. Insertion continues until the tip of the catheter reaches the junction of the superior vena cava and the right atrium. All types of central venous catheters are advanced until they reach this location. PICC lines have several advantages, including freedom from repeated venipuncture, flexibility and comfort, relatively easy changing and removal of the catheter, and ease of insertion. In fact, specially trained nurses can insert PICC lines. Disadvantages of PICCs include restricted patient activity, required routine care, and visibility on the patient's arm. If you've received special training, you can insert a PICC line yourself. First, make sure the patient has given informed consent. Then gather the appropriate supplies and bring them to the patient's bedside. To prepare for the insertion, wash your hands for a full minute with antimicrobial soap. Then, help the patient into the supine or semi-Fowler's position and extend his arm at a 45-degree angle. Open the PICC insertion kit. Now apply a tourniquet on his upper arm. Assess the antecubital fossa for redness, tenderness, edema, or drainage. If you see any of these problems, select another site. If you don't see these problems, look for a vein that's smooth and straight for a length of about 1 inch. Now remove the tourniquet. Next, find the distance from the insertion site to the site where the tip of the catheter will be located. Using a tape measure, measure from the insertion site to the patient's shoulder and from the shoulder to the sternal notch. Then add 7 centimeters to this number to determine the appropriate length for the PICC line. Now you're ready to prepare for the insertion. Place a mask on the patient or ask him to turn his head away. Then put on a face mask and sterile gown. Remove the sterile kit from the tray and apply sterile gloves. Arrange the sterile equipment on the sterile field. Prepare a 10 milliliter syringe with 10 milliliters of normal saline solution. Prepare a 10 milliliter syringe with 5 milliliters of heparin, the 100 units per milliliter concentration. Take the catheter from the kit and make sure it's straight and intact. Use the sterile measuring tape to measure the catheter, starting at the hub. Cut the catheter tip straight across to make the catheter the correct length for the patient. Attach the saline-filled syringe to the catheter and flush it. Place the catheter with the syringe attached back on the sterile field. To prepare the insertion site, clean it with an alcohol swab, starting at the intended site and working outward in a circular pattern until you've covered about 3 inches above and 3 inches below the insertion site. Repeat this step with 2 more alcohol swabs. Now clean the site in the same manner with the povidone iodine swabs. As needed, pat around the site with sterile gauze to remove excess povidone iodine, making sure you don't touch the site itself. Now remove and discard your gloves. Reapply the tourniquet about 4 inches above the antecubital fossa. After putting on a new pair of sterile gloves, place a sterile drape under the patient's arm. Then place a sterile drape so it covers the patient's forearm and hand, but not the insertion site. Drop a sterile 4-inch by 4-inch gauze pad on top of the tourniquet. Next, use your non-dominant hand to palpate the vein and stretch the skin taut. Insert the catheter introducer into the vein at a 15 to 30 degree angle. When blood appears in the flashback chamber, gently advance the introducer until the tip of the sheath is well inside the vein. Release the tourniquet by grasping the 4x4 gauze. Apply pressure on the vein just above the distal end of the introducer sheath to minimize blood loss. Now carefully withdraw the needle while holding the introducer steady. Using aseptic technique, insert the catheter into the introducer and advance it into the vein using short, swift strokes. When the catheter tip reaches the patient's shoulder, have him turn his head toward the insertion site and put his chin to his shoulder. This movement prevents the catheter from going into his jugular vein. Advance the catheter until about 4 inches remain outside the patient's arm. Aspirate for blood to make sure the catheter is placed correctly. Now remove the introducer sheath from the vein, leaving the catheter in place. Bring the tabs of the introducer up until the sheath is completely split. Discard the introducer sheath. Continue to advance the catheter until about 2 inches extends from the insertion site. Then flush the catheter with the remaining saline